My name is Dr. Jim Sutton, and I'm a psychologist. Listen to this correspondence I received from a very concerned father. Our 13-year-old son has issues his mother and I cannot address. He is so defiant, but he also seems lethargic and depressed much of the time. We just don't communicate anymore, and it's tearing us apart. I know we need the help of a therapist, but how do we know which ones are really good at working with young people? Also, how would we go about finding a counselor or a therapist? I'd like to address these questions because I'm certain these parents were not alone in their concerns. The comments actually contain two questions. What makes a good counselor or therapist, and how do we find them? Let's cover the first question. What makes a good counselor or therapist? The decision to seek professional assistance with a difficult and defiant child or teen can be an ordeal in itself. Folks don't shop at leisure for a counselor or therapist any more than they shop for a surgeon. Searching is the result of needing, and the searching can be as stressful as the reasons for the search. Here's a short list of what to look for in a competent counselor or therapist. And just for keeping things simple, we'll use the terms counselor and therapist interchangeably. Look for someone who is credentialed and experienced. Some states have no licensing or boards that govern counseling and psychological services. It's a good idea to ask a counselor where they trained and what licenses they hold. It's also a good idea to find someone who's been practicing long enough to have some in-the-trenches experience. There just aren't many shortcuts for that. Look for someone who devotes a good part of their practice to working with children and families. A therapist who has a child and family practice and also does addiction therapy, vocational counseling, grief work, marriage counseling, weight loss, and hypnosis for smoking might just be sending a very clear message. They don't do any of those things especially well. We do live in an age of specialty, and it pays to get an expert. Look for someone who understands oppositional and defiant behavior thoroughly. This one is huge. Just about every oppositional and defiant youngster looks wonderful as they sit one-on-one with the therapist for the first visit. These kids are great at hiding their symptoms, but they cannot do it forever. A wise therapist will build in compliance tasks and requests into their work with the youngster, and this cuts through the acting okay stuff pretty quickly as they move across the sessions. The therapist will also be interested in seeing actual evidence of presenting problems such as grades and discipline referrals from school. A good counselor knows how to look for comorbid or coexisting symptoms such as depression or anxiety in addition to behavioral issues, and that's common. Look for someone who will work with you on school problems. In my opinion, a child and family counselor who wants to do everything from the comfort of their office might not have the child's best interest in mind. If there are issues at school or special meetings going on, the counselor could be a valuable component in the decisions made and the interventions used and considered. Caution: as good as it is for a counselor to communicate and work with a school, I would also be very concerned about any counselor who tries to take over a meeting at school. Look for someone who will connect with your child. Going to a therapist for the first time is never high on any youngster's list of things to do. As often as not, kids perceive the therapist or the counselor as their punishment for their defiance and poor behavior. A good therapist quickly and authentically gains rapport with the youngster and positions themselves as a resource. They work hard to establish themselves as someone the youngster sees as having the authority and the clout to relieve their discomfort and pain, starting with the first session. The therapist gains the youngster's trust in small steps, showing the child things can be better. If the therapist is good at accomplishing these things, the youngster will want to continue seeing them. Now to answer the second question, how do you find a good counselor or therapist? Well, as you might guess, counselors and therapists with the largest and flashiest ads in the yellow pages might not be the ones for you and your child. Those with the best track record have a strong word-of-mouth reputation. News of their effectiveness gets around pretty quickly. They don't need the big box ads. In fact, many of them stay as busy as they want on the strength of their reputation alone. Here are a few suggestions for locating a good counselor or therapist for your child. A personal referral. Make an effort to speak with parents who have worked with a therapist or counselor in the area. Folks who have been there and have had a good experience with a professional don't mind passing along a name and the contact information. If you don't know of any such parents personally, ask around. Put the word out with family, friends, and acquaintances. A professional referral. Check with your pediatrician or family physician. They should have occasion to know the good therapists and counselors in the area. Sometimes counselors and therapists provide services through a pediatrician or a pediatric services group. Now, this doesn't always mean these folks are top shelf, but if your doctor already knows them, at least you're not starting from scratch. School counselors, especially those salted with some experience, can also be an excellent resource. They are required to maintain a school crisis plan and keep it up to date. This includes a list of community resources and their contacts. If the school counselor is working or has worked with your child, they would even be better placed to make a recommendation or a referral. Professional associations. Counties with substantial populations also often have a county psychological association, as well as the possibility of similar associations for counselors, social workers, and therapists. They often operate a referral line. Folks handling the phone and returning the calls can save you a great deal of time and frustration by matching a few professionals to your specific needs. It's always nice to have a choice. Even factors like location and office hours can make a difference. And last, a university clinic. If you live close to a major university, you might do well to contact the departments of psychology, counseling, social work, or special education. These folks often can help you find a competent professional quickly, possibly a professor right there in the department. These departments sometimes operate counseling and therapy labs or clinics for the purpose of training students. They're actually looking for children and teens, and the cost usually is nominal or free. University students are closely supervised and are highly motivated to do well. They staff their lab cases regularly with their supervising professors. Besides, students working on advanced degrees are likely to have substantial experience anyway. I'm Dr. James Sutton, and I hope this has been helpful.